I'm Brianna and I live in Grand Prairie, Texas. I'm a mother of two and a wife. My first pregnancy was wonderful, so I thought that the second pregnancy would be a joy. Everything was different. It was very different. The delivery went great all the way up until it was time to get the placenta out. When it was time to get the placenta out, it took about 30 minutes. 10 hours later, I ended up noticing that I had a lot of blood flow going on. Like I didn't know or wasn't aware about hemorrhaging at this time. But I did notice that I was filling up those, the pads that they give you in the hospital. I later found out that that was uterine atony that happened. So with some of the placenta being left inside, and they had to actually do a 5-hour surgery just to repair the tear that they couldn't repair at first, because they did let me know that they was going to take out my uterus. So the last day, I just had a feeling to ask her to check my heart. I started feeling like a flutter. It was like something tickling in my heart. My sister, when she passed away, she was 27 years old, and she had died of a cardiac arrest 6 months after giving birth to her second child. She saw in my family history that I did lose a sister from a cardiac arrest. So she kind of understood my concerns, on why I wanted her to check my heart. She said, "Oh, you have a heart murmur." She said it's harmless, it'll go away after birth. So fast forward later, I just asked her to recheck it, and she did, and she checked out everything. She told me that everything looked good, and I was pretty much sent home after that. About 2 weeks later, I ended up developed a cough. Another 2 weeks passed, and I got a little worse. At this point, I started, the coughing became more severe. It was starting to become like a chronic cough. So at this point, we're 6 weeks postpartum. I just remember feeling my heart just pounding. It was just boom, boom, boom. So I laid down that night, and I literally got back up. After I laid down, I was gasping for air. I couldn't breathe at all. When I laid down, if you know how it feels when you're underwater for so long and you can't get back up, that's exactly how I felt. And so I leaned over, and that's when I reached out to my dad. It was like, at this point, it's like probably 3, 4 in the morning, and I'm just up. I had to literally prop myself up so I could breathe. And I'm like, "Dad, I can't breathe when I lay down," and he said, "What?" He texted me back immediately. He was like, "That don't sound normal, Bree. You may need to go to the hospital." And so I texted back and said, "No, I'll be all right." I said, "I see the obstetrician this week anyway." He was like, "No, I don't think you need to wait. You need to go in." He said, "That might be pneumonia or bronchitis that you're dealing with." And I said, "Okay." When I said, "Well, I got the baby," I was like, "I'm not trying to do all that." He was like, "I'll take you myself." So he literally came and got me. What happened next was, after, we ended up getting myself into the hospital, they took me in really quick, because they said they took shortness of breath really serious. So they pretty much, got me in. They checked my vitals. They said that, things, my vital signs were, not normal. They did say I had some fluttering in the heart, or I had heart palpitations is what they called it. They also noticed the swelling that I had, and then also my oxygen levels was at 82. So they knew it was something wrong. They didn't know what yet. And then they actually had me go and do an x-ray. And then next thing I know, the ER doctor comes in after he looks over the scans and everything. He said, "You have an enlarged heart. You're a big-hearted person." He was trying to do it in a nice way. And so once the cardiologist got in the room, he looked over my file, and he saw that my sister had died of a cardiac arrest. He did ask me, did she have a baby, prior to the heart condition. And I said, "Yeah, she did." And then he asked me, he said, "And you just had a baby as well, right?" He said, I don't like what I'm seeing, and he just kind of let me know that I was suffering from heart failure, and that's why I had been dealing with those symptoms. And he did say that, it was peripartum cardiomyopathy. So he diagnosed me with peripartum cardiomyopathy, also known as PPCM. I wanted to survive, so I had to do certain things in order to help the medication work for my body. And one of those things, he did include a cardiac rehab. So I had to go to cardiac rehab. And what they do there is just kind of work with the patients who have heart failure, and they make you exercise, even though you're out of breath. But they said that's what helps, regain the strength of the heart. If something doesn't feel right, get help. Hear Her Texas.